So today we're going to talk about understanding Salmonella, what it is, and which horses are at risk. So Salmonella is a bacteria that can cause infections in humans, most mammals, and in birds, and it's an important cause of disease in horses. It's a challenging bacteria for a number of reasons, one of which is that it can cause zoonotic infections where the infection passes from an infected horse to its handler. So it's a health and safety, potential health and safety thing that we need to be aware of. It can survive long periods, both in carrier horses and in the environment. And it's often resistant to antibiotics, so proving challenging, gives us challenges for managing things like joint infections with Salmonella organisms. So how is it spread? Well, it's the fecal-oral route. So an infected horse will pass Salmonella organisms in its feces, and an uninfected horse has to eat those Salmonella organisms in order to become infected. And horses can get Salmonella in a number of ways. So if we think of our baby foals that are searching around a mare's udder and along her legs, they can pick up Salmonella organisms that way in their searching behavior. They also can eat the mare's feces as part of their normal behaviors after a couple of days and get infected in that way. Other horses, they can eat contaminated grass, hay, or other feed and ingest bacteria in that way. Or it can be our staff via unwashed hands or contaminated boots where they've got where they carry the Salmonella organisms from an infected horse onto the uninfected horse. We can also do it indirectly via equipment such as water buckets, feed buckets, and other tools. And then our rodents in the barn, they also can add to problems by not only carrying the Salmonella from one area of the barn to another area, but also the Salmonella can incubate in the intestines of the rodents and get passed out in larger numbers. So controlling rodents being part of the aim with the Salmonella issue. Obviously, in our recent mice plagues, that's been a challenge. One of the challenging aspects of Salmonella infections is these silent carriers or Salmonella shedders. And this is where an outwardly healthy horse is showing no sign of disease whatsoever, but carrying Salmonella in their gut. And they can be shedding it intermittently or continuously. And while they're infected, they're a source of infection both for themselves and for other horses. Most of these horses will clear the Salmonella from their systems within days or weeks, or at most months of getting infected. Unlike the situation in cattle can get infected for the life of the animal, but horses will clear it at least within a few months. Just a low percentage of healthy horses are positive, but in sick horses, this percentage is much higher. So particularly a horse that has active infection and diarrhea with Salmonella, it can be shedding really quite large numbers of Salmonella organisms in its feces. So one of the important things with a horse with diarrhea is to isolate it. So how do we diagnose Salmonella infections? The main way we diagnose is through fecal cultures. These get submitted to the lab, and the lab will tell us if they're positive or negative. It does take 3 to 5 days for the lab to return either a positive or a negative result. And a single fecal culture doesn't tell us much about the status of a horse. So because of various reasons, such as they can be shedding the Salmonella intermittently, not continuously. So not all samples will be positive from the same animal. And also, if they have got watery diarrhea, you can get dilution of the Salmonella organisms down to low numbers. We need to take multiple samples, ideally 5, between 12 to 24 hours apart, before we can be confident that a horse is either negative or positive for Salmonella. That delay of 3 to 5 days before getting a result does delay, the return of the diagnosis. But for any horse with diarrhea, we'll be isolating them anyway. The other option that we have is there are Salmonella PCR tests or polymerase chain reaction tests. And they will return a result within 24 hours, which is useful. But because of that intermittent shedding that's possible, we need to collect at least 3 samples from each horse, again, 12 to 24 hours apart. And the only negative with a PCR test is it doesn't give us any results such as antibiotic sensitivity results. So yeah, there's various ways of diagnosing it, and these being the most common two. So for salmonella infections, there's been a lot of research into it, particularly overseas in the States, and there's established risk factors. If we talk about these now, so stress is one. So it may be the stress of a change in herd dynamics. It may be the stress of having, being ill for other reasons. Transporting a horse from, particularly at the distances that are involved in Australia. And also, we know that our thoroughbred horses move around a lot, and this can put a horse at risk. A change or withholding feed, and again, that's something that occurs commonly on the farms. GIT disorders, so anything that disturbs the function or the motility of the gut, can predispose a horse to a salmonella infection. An example of this would be colic surgery. High ambient temperatures, which are really hard to avoid in Australian summers, and antimicrobial therapy. And the main, while we try and reduce as much as possible our antimicrobial use, it's certainly with breeding and rearing horses, it's not possible to eliminate its use. When they get infections, they're often needing treatment. And the antimicrobials, there's a risk that they can knock out the healthy flora in a horse's gut, and lead to overgrowth of these bad bacteria or salmonella. So again, a lot of these risk factors will be present at some stages of a horse's life. If a horse gets exposed to a large number of salmonella organisms, and he's healthy, he's likely he may get infected. But if he has one of these risk factors, a much smaller number of bacteria can cause an infection. So what are the clinical scenarios? So I said before, we can have a normal horse that is shedding salmonella bacteria, but has no outward signs of disease. So is looking no fevers, looking healthy, but is shedding in the environment. Or you can have a horse that has clinical disease, and these can range from mild infections to quite severe. So with a mild infection, you could have a horse that just goes off its feed, is a bit dull, species might come a little loose, and the horse then rebounds and is clinically, clinically no signs within 24, 48 hours. The other possibility is you can get a horse that gets quite a severe an acute colitis or inflammation of its colon and cecum, and this can result in the production of large volume of diarrhea and a lot of fluid loss, and these horses can be pretty sick and can die of the disease. In foals, because they have a naive immune system, the salmonella bacteria are less likely to just stay in the gut, and they're more likely to get into the bloodstream and cause infection or sepsis that goes around into the foal's body systems. Localized joint infections are also possible with salmonella infections, particularly in foals, and can be a challenge to treat due to what we said before about the antibiotic resistance. So with a horse with an acute colitis, the first thing that people mostly notice is they go off their feed, they're a bit dull, and they can show signs of colic, and they may have a fever, and because of the loss of quite a lot of fluid into their gut, they can lose a lot of circulating volume and show up quite dehydrated. They can become quite toxic and get injected mucous membranes. And then they go on to produce diarrhea, which initially may have some mucus and some blood in it, particularly with salmonella infections. The treatment of an acute colitis, I'm not going to go through in detail, but safe to say is that these horses will need intensive treatments, and the mainstay of treatment is large volumes of intravenous fluids to replace what they're losing into the gut and from their circulatory systems. They'll often receive plasma, anti-inflammatories, cryotherapy or icing of their feet, and intensive supportive nursing to help them get over the infection. So what are the steps that you can do in the farms to prevent infection? Well, as we said, the Salmonella bacteria are passed in the feces. So in your barn, strict attention to cleanliness and cleaning up after horses. And this can make a big difference. Preventing overcrowding. So trying to reduce any stress in your herd groups. Trying to limit possible exposure. If you have a horse that's that goes away from your farm and comes back to quarantine it for a period, and the same with new arrivals. And one thing, if you have a horse that breaks with diarrhea on farm and you don't know if it's due to a Salmonella infection or due to, there are obviously lots of other causes of diarrhea, but just being proactive and isolating that horse pending test results to test to see if it's negative or positive, because while it's got diarrhea, it can be shedding large numbers of bacteria and the Salmonella organisms into your environment, and you don't want to be a bit like COVID. You don't want to be the person that carries it from an infected horse onto an uninfected horse, leading to spread within the farm horses. Hand hygiene of your staff is really important. Ideally washing hands in between handling horses, or thanks to COVID, we've got all these alcohol hand sanitizers to use, which are good. Or else, wearing in the higher risk horses, so those with diarrhea, to wearing examination gloves when examining them. Foot dips and foot mats are really useful, and I often see them strategically placed around farms, which is great. But I think sometimes it can be forgotten that they need to be maintained. So if we can see that picture on the top left of a foot bath where there's lots of soil, there's lots of dirt in it, and in that situation, the disinfectant won't be working properly, and also it encourages non-compliance because nobody wants to step in it. So rather than walking through the foot baths, they walk around it. So maintenance of your foot baths is really important. During the sort of hot times during the Australian summers, the disinfectants can evaporate pretty quickly and need to be replaced at regular intervals. So the question we get often asked is, how do you manage a positive case on farm? And I think the key is to have a sensible approach, and there's a lot you can do to manage the situation. Putting a horse in a positive case in an isolation barn away from other horses, and limiting access to just essential staff that are aware of the horse's problem, but not having any other staff going through the barn, unless strictly necessary. While a horse has a confirmed infection, wearing personal protective equipment. So we would suggest cover boots, examination gloves, and an isolation suit. And after 6 to 8 weeks, running fecal cultures, ideally that 5 fecal culture number, in order to see if the horse has cleared the infection. If the horse has cleared the infection, the horse can come out of isolation. If it's still positive, you may have to wait a while and retest after another 4 weeks. But as I say, it's uncommon for a horse to stay, to remain infected. Studies have shown with these measures that the risk of spread of infection on your farm is minimal. Again, just taking things sensibly and doing what you need to do. You will note that infection control in veterinary hospitals is often at a higher level than out on the farms, and this is for various reasons. First of all, we're not dealing with healthy horses. So it's very rare for you to send a healthy horse into the hospitals. It's mainly horses that are sick and have can have immune compromise. There's many of the risk factors present for putting them at risk of salmonella infections, such as they've often traveled in, they're often have gastrointestinal disease, they're often needing invasive procedures and general anesthetics, etc. So there's many reasons why this is not a healthy horse population like you see out on the farms. We also have coming together of horses from many different farms, so we will treat every horse as potentially infectious, because we don't want to be carrying infection from one horse on to the next. And that is it. So any